Now we are dealing with tracheostomy like any invasive line, like Foley's catheter, like central line, like cannula. We are looking to remove it out. Tracheostomy, weaning and decannulation. Once the patient condition improve and tracheostomy indication is resolved, the weaning and decannulation process must be started immediately. Weaning, it means gradually. It is a sequential process by which the patient move from the state of dependence on a tracheostomy to a state of independent, where the upper airway is patent, the respiratory parameters are optimal, with little or no supports required. Decannulation, it means the process of removing of the tracheostomy, and patient breathing is well without the tracheostomy. If you notice here, the patient initially he has cough in the first step. He has cough tracheostomy in a size maybe like 7 or 8. Now the second step is to decrease the size of the tracheostomy. After that, you will make it without cough to make sure that he can take a breath and he has no edema, he has no obstructions, he can be without mechanical ventilator. After that, they can like block the tracheostomy by cap to make sure that this patient, if we remove the tracheostomy, he can protect his airway. He will not suffer from respiratory arrest or airway obstruction. There are several criteria to be met before considering weaning and decannulation. The first, the reason of tracheostomy should be resolved. There is no acute respiratory problem like pneumonia, shortness of breath, and respiratory insufficiency. A minimal secretion, usually they will tell less than 4 to 6 hours needed to be suctioned. A strong cough or gag reflex, sufficient to clear the secretion. Oxygen saturation is acceptable. Patient is not on mechanical ventilator more than 48 hours. The patient has no anatomical upper airway obstruction or limitations. Now, imagine the patient tracheostomy suddenly removed. What I have to do? If the tracheostomy is fresh, less than 7 days, then cover it with a sterile occlusive dressing and ventilate through the ambu bag. Probably they will intubate the patient. If the stoma is mature and it's more than 7 days, the practitioner will insert a new tracheostomy using curved hemostat or what we call a tracheal dilator to insert a new one. Now I believe we completed the series of videos where we spoke about the tracheostomy indications, insertion, care and maintenance, suctioning, sampling, weaning off. I hope these videos were helpful for you, and thank you so much for your watching. See you.